Welcome, everybody, to the second BoogerDownBronx live Q&A. Really excited. I'm Dr. Dylan Levy. This is the second one that we're hosting. This evening's topic is going to be tonsils, tonsillectomy, tonsillitis, everything you want to know, probably too much you want to know about tonsils. And I'm joined by one of my very, very good friends, Laura. So excited to have you here. Thanks for joining and taking time out on your Thursday night to come.
Yeah.
Yeah.
I'm excited to be here. Yeah, so I have a very important question for you just to kind of start things off. I don't even know what tonsils really do.
Yes.
So if we could just lay that out first, and then we can get into like the really good stuff.
Sure, that's a good place to start. So tonsils are lymphatic tissue. They sit in the back of your throat. You have two of them, one on each side, and they actually are part of something called Waldeyer's ring, which is basically just a ring of lymphatic tissue. And lymphatic tissue, what it is part of our immune system, helps us fight infection. So that's why, especially in kids, these tonsils can get enlarged, because when kids get inflamed, either from infections or allergies or just exposure to any sort of bacteria, they can become inflamed and they become large and they can cause problems, because obviously they're sitting in your throat, and your throat is how you breathe, how you swallow, how you speak. So that's essentially what tonsils do. They're part of a larger system, and they cause some serious problems in adults and in kids.
Okay, so, well, I'm a mom.
Yes.
And so like a lot of my friends have been talking about like, okay, like when can we test for strep or anything? Like I've taken, my daughter, I have a 2-year-old, to the doctor before, and she was very symptomatic and everything. And they said, and I wanted to test for strep, and they were like, no, we don't need to test for strep. So like, why wouldn't they test for strep?
That's actually really good that your doctor didn't do that. So the data actually suggests that most kids under 3 who have sore throats are likely viral. And the Infectious Disease Society of America actually recommends against testing kids under 3 for strep. The reason why is, one, because most of them are viral. Second of all, they're less likely to actually carry strep and have the complications from strep throat. So some of the complications we worry about related to it affecting your heart, it affecting your kidneys, and they're less likely to have those complications. So unless the kid is immunocompromised or they are around a sibling who has strep, typically kids under 3 recommend don't test for strep.
Okay, so then what if like she's older, she's like starts like snoring and stuff like that? I know that's like kind of like that's sleep apnea, right?
Well, it can be. So snoring in children is not normal, but that doesn't necessarily mean that they have sleep apnea. So what snoring is it's the tissues in your throat vibrating while you're breathing, while you're sleeping. So it happens in kids and it happens in adults. And in kids, it really shouldn't happen. But typically anything more than 3 nights a week that's ongoing is certainly abnormal and should be worked up, because we'd be concerned about something called sleep apnea.
Okay, so but how does that connect with like actual, like with what's going on in their throat and everything?
In the tonsils.
Yeah, in the tonsils.
So great question. So sleep apnea, one of the reasons why we become so concerned about it, because essentially what's happening is that the tissue in the throat is causing an obstruction and a blockage while the kids are trying to sleep. And as this happens, the oxygen in their blood can tank and can go down. And if this is happening multiple times an hour, every night while these kids are sleeping, that causes significant strain on the heart and on the lungs. So we certainly do care about sleep apnea. And the reason why that's connected to tonsils and to adenoid tissue, which are very similar to tonsils but in the back of the nose, is because these are what are commonly causing the obstruction in children. So if a child does have sleep apnea, the recommended treatment for children is surgical removal of their tonsils and adenoids if they are enlarged.
Okay, well, surgery always sounds really scary, especially when you have a kid.
Yeah, absolutely.
Definitely want to talk a little bit about that, but I want to also understand, like, if they have a ton of symptoms, like if they have like a fever or like lymph nodes and stuff like that, is there like, are there ways to like treat this without surgery or?
So yes, there are ways to treat it, but so let's talk about the 2 main indications for taking tonsils out.
Okay.
So that'd be recurrent strep throat and sleep apnea. Those are the main 2 reasons that we take them out in children. So for strep throat in kids, we're looking for a specific number of strep throat infections that have to be documented. The threshold is 7 infections per year, which is a lot of documented strep throat infections. But if you're not meeting that threshold, it also can go down if you average it over 2 years. So the other criteria are 5 infections per year over 2 years, or 3 infections per year over 3 years. So again, these are documented strep throat infections, not just sore throats. And as a surgeon and as a clinician, it's not easy to differentiate that. I get a lot of patients come in and they say, oh yeah, I've got a throat infection every month. And in their mind, that's just, I feel sick and my throat hurts. So it's really important to understand that these have to be documented strep throat infections. So they need to have a sore throat with a fever, swollen lymph nodes, or a positive strep test. And that needs to be documented. So it's not easy to always get all that documentation. So it's important to educate the parents that this is kind of what we need in order to build the case towards maybe getting the tonsils out to see, because you don't want to just take the tonsils out just because we're getting sore throats. There's other causes for sore throats. So I hope that helped answer your question.
No, it definitely does. It definitely does. No, that's really helpful. And I think like as a mom and I'm like anticipating a lot of things. Luckily, like we have a very healthy child and like, you know, she's had a few, we've gotten a few scares and things like that. But I realize when these things happen that I am not as prepared as I want to be. And I don't exactly know what to look for. So I like that you're just giving me like all of the different symptoms and like, you know, multiple things to look for. I know that when in the past I've heard when you're looking for strep, you're looking for like white patches in the throat and stuff like that. But I don't even know, like, what do you mean white patches in the throat? I don't even know what a tonsil looks like, Dylan. I don't even know if I have tonsils.
Do you want me to show you? There's a strong light on me. No.
Like
you probably have tonsils.
Can we? So, I don't even know.
No, don't show anyone your tonsils.
Do you want to see?
I do have a light on me, but no one wants to see your tonsils.
Okay, we'll just leave my tonsils in. We'll look for them later.
I'll look at your tonsils later. So essentially what they are, they're almost 2 little round soft tissue balls, and they sit in the back of your throat, just behind your teeth. Okay. 1 on each side. And you may not even be able to see yours because in most adults, they're pretty small. But when they're big and they're red and they're infected and you see these white spots, that's called exudate or pus. And that is a sign of infection, but not necessarily strep throat infection. Certainly viruses can cause, white spots on the tonsils. Mono is a very common one. Other bacteria can cause white spots on the tonsils. So it's important to understand the whole constellation of symptoms because, if a kid comes in with a runny nose, spots on the tonsils, sore throat, and a cough, and that's most likely a virus and not strep throat.
Okay. All right. So
a lot to chew on there.
Yeah, because that ambiguity can also just like freak parents out. And
Absolutely.
Like, obviously mono's not great either. So we want to be able to weigh all the options. And if, we take our kid to the doctor and they say, okay, we recommend a tonsillectomy. Number one, surgery is scary. I'm I'm freaked out about surgeries. My question, I guess, would be one, you mentioned that like tonsils are obviously important for like the lymphatic system and everything like that. So one, can you obviously people can live. Yeah, like people can live without their tonsils. Like why would you?
So there's been a lot of good research into it.
Yeah.
And the short answer is there are no real long-term consequences of removing your tonsils.
Okay.
They don't play that important of a role in the immune system and protecting against upper respiratory infections once you pass a year or 2 old. So there is some data to, population studies, certainly not any randomized controlled trials that, are compelling, that don't show that there's any consequences to taking out the tonsils. Now, there are certainly risks to surgery, to removing the tonsils and the adenoids. And, I certainly make sure that the parents understand the risk when we talk about removing tonsils, especially for something they just said, oh, my kid just snores. What do you mean removing the tonsils? So they're important conversations to have. And it's something I take very seriously, as do most surgeons. We got some bites here. What about, what do you think about these? Anything worthy here?
Oh my gosh. Okay. Yes. Sleep disordered breathing can also affect attention and behavior in children. And what about children who are strep carriers? Oh, what does that mean? A strep carrier? Like a carrier, but not infected.
So that's a great question. So Chronic strep carriers are essentially when children become colonized with group A strep in their throat. And what does colonization mean? Oh, that it means that they're not actively infected, but if you swab them, if they have a cold or some symptoms and they get swabbed with a rapid test, they're going to test positive for strep, even though they're likely suffering from a virus. So up to 10 to 15% of kids can become chronic strep carriers. So
Yikes.
that's why we certainly don't recommend testing all kids, and it's important to use specific clinical criteria to determine who you should and shouldn't test. And the other thing you mentioned, what was this? Sleep disorder breathing can also affect attention and behavior in children. So that's not a question, but that is absolutely true. So sleep apnea and sleep disordered breathing in children has a whole slew of symptoms and signs. And, there are nighttime signs that we look out for that I'm always asking parents. Are they struggling to breathe at night? Are they waking, gasping for air? Are they having restless sleep? Are they waking up all the time during the sleep? Again, those are nighttime symptoms. Daytime symptoms. Now, a lot of parents don't make the connection, but things such as inattentiveness, hyperactivity, a lot of kids are being misdiagnosed with ADHD. And in fact, it's related to poor sleep quality from sleep apnea. So a lot of that can be corrected in kids once you treat the sleep apnea and address it with airway surgery.
That's super interesting. And I feel like we talk about it a lot as adults. I feel like half the adults that I know right now are on like CPAPs and stuff.
Okay.
So yeah, like sleep apnea is so common.
It is very common.
But it's not always because of their tonsils and things like that. So but I know that tonsillectomies can also be really difficult with like adults versus kids. It's a super like long recovery and everything like that. Can you tell me a little bit more about that and like why?
Yes. So a couple things I'll unpack there. So tonsillectomy and adenoidectomy are the first line treatment for sleep apnea in children. In adults, as you mentioned, CPAP is typically what's recommended first. That's a non-surgical option and can effectively treat almost everybody with sleep apnea, with obstructive sleep apnea. The thing is, children, most of them will not tolerate a machine while they're trying to sleep.
Right.
And because of the size of their airways and the anatomic causes of obstruction, that's why the society guidelines recommend surgery for children and not necessarily for adults as first-line treatment. The other thing you asked about recovery at adults versus children, so universally, adults have a significantly harder time. They have higher returns to the hospital after surgery, higher risk of bleeding and dehydration. And it's not just because children are more resilient. You see your kid fall down, and if you fell down like that, it would hurt.
Literally yesterday.
Yeah, falling off couches, off tables, all that stuff. But so pain receptors are different in children. But the other important thing is that when you take out tonsils in adults, as opposed to in children where you're oftentimes doing it for sleep apnea, in adults you're often doing it for recurrent tonsillitis, tonsil stones, and it's repeated infections and inflammation. And as a result, when you're trying to do that surgery and remove those tonsils, surgically, it's more challenging. There's a lot more inflammation. You often have to use more cautery to control the bleeding. And so that's why adults typically have a rougher course. We're blowing up over here.
Yeah, we've got a lot of questions. So
a lot of eager people here.
Okay, this one says 7-year-old has huge tonsils and never had infections or needed ABX?
Antibiotics.
Oh. Would it still be recommended to see an ENT?
So I guess this is from a medical person that they're writing ABX, shorthand for antibiotics. But long story short, large tonsils don't necessarily need to be removed, especially in children if they're not causing sleep issues or recurrent tonsil infections. I do get a lot of referrals. A parent comes in and says, my pediatrician said the tonsils are huge. What do we do about it? Are you going to cut them out or what? And so that's where it goes into a detailed history. Are we having recurrent strep throats? Are these documented? Is the child having any issues related to the tonsils, issues eating, trouble sleeping, snoring? And if none of that, oftentimes I just say, let's observe them. And that's usually the right path. Try to avoid surgery if you can. And the kids, as their airways grow, the size of the tonsils will typically affect them less.
Okay. Well, good. Okay. I mean, okay, this is an interesting question. Can tonsils grow back after being removed?
Ooh, that is a good question. So someone's bringing the heat over here.
Ooh,
So
yeah.
if they
Noodle
are
NYC coming at you.
if they are removed, they should not grow back. But there's an important caveat. So there is a new, essentially, type of tonsillectomy that's being offered to children, and that's called intracapsular or a partial tonsillectomy and or tonsillectomy shaving. It goes by all sorts of different names, but essentially what it is you are removing the tonsil up to the capsule of the tonsil and not the whole thing. Now, the advantages of that is it's less painful. There's less risk of bleeding and dehydration. But in those cases, there is a small chance of tonsils growing back. Now, are they likely to grow back to the extent that they're causing snoring issues and blockage? Probably not. But if they are having recurrent strep throat, it could still cause a problem. So, Noodle NYC, thank you for that thoughtful question.
Yeah, I had no idea. That's crazy. Okay, how contagious is strep, and how good are rapid tests versus culture? And can we test at home like COVID? This is the three-parter, okay?
Okay.
How contagious is strep?
Someone loves strep throat. So strep throat is very contagious. That's why it spreads like rapid fire through the school. I don't have the exact epidemiologic, rate of spread like they were releasing with COVID back in the day, but it is contagious. But along those lines, we could talk about when is someone considered not contagious. And so the guidelines do address this, and they address it pretty clearly. So the guidelines say if a child has been on antibiotics for 12 hours and without a fever, and that means a fever with no fever-reducing medicines like Tylenol, then they are safe to go back to school and no longer considered contagious.
Okay. And
what else did we have in that?
How good are rapid tests versus cultures?
So rapid strep tests are great. They're fantastic. They're quick. They're relatively cheap, but they are not perfect. They do have a false positive rate.
Yeah, what happens then?
So if there is a false positive rate, I don't have the exact number on my mind. I think it's something about 10%. Well, that means the test is coming back positive. In reality, the child does not have strep throat. Now, they could be a chronic strep carrier, which again goes back to being selectful about who you're actually testing for strep throat. And this is addressed in the guidelines. That's why we have something called the Centaur criteria. And we don't need to go into that in great detail, but it helps clinicians determine who should and shouldn't get a rapid test. Now, there's also a good rate of false negatives. I think it's as high as 30%. And that's why the guidelines recommend if you have someone who you're suspicious for strep throat and the rapid is negative, you should always follow it up with a culture. Now, cultures are much more sensitive. I want to say something in the high 90s for detecting strep throat. The downside is they can take 24 to 48 hours to result. So the guidelines say if you're suspicious for strep throat, the rapid is negative, follow it up with a culture. And I do see a lot of people who come and they see me, I got a rapid test, it was negative, and they still gave me antibiotics, and no, they didn't do a culture. So what are we treating in that scenario? I mean, are we treating the patients who are just asking for antibiotics, or are we actually treating strep throat here?
Well, what would you do in that situation if they're waiting on the culture?
I would encourage supportive treatment. So if they're in pain, treat with Tylenol, ibuprofen, rest, hydrate, all the supportive measures that most people should know. And I'd wait for the culture. And if the culture doesn't come back positive, I'd say, great news, you don't have strep.
All right. And kids should not be going to school at that point then.
I mean, if they're sick and they have a fever, probably keep them home from school.
Yeah. Right.
Yeah, keep them home from school.
Right. Yeah. Keep them home.
Keep the kids home.
Keep the kids at home. And then, can we test at home like COVID? Are there like strep tests for at home?
Oh, that's a good question. Honestly, I don't know. I do all my testing in my clinic. I haven't gone to the pharmacy for a rapid strep test.
I haven't seen them at Dwayne Reed, girl. Or sir.
They might be. I know they have these like flu, COVID, RSV combo swabs. You recently were you able to get a home test? You were. Okay, so There you go. Oh no, you weren't. Okay, no home strep tests, according to my wife who recently had strep.
Oh no, I did.
Corrected. She did have a home test. All right. Anywho.
It was negative, but I was treated for it.
My child has tonsillitis and often kisses her teddy bear before going to sleep. Do I need to throw away all of her stuffies like they did in the Velveteen Rabbit with scarlet fever?
You should make your kid throw away those stuffies. Make them understand the importance of not spreading germs. No, you don't need to throw away the stuffies. Keep the stuffies. Strep probably can't live on a stuffy for very long.
How long?
I don't have any data to support that.
No, okay.
Don't throw away your kid's favorite stuffies just because they're cuddling at night. But
yeah, you're a monster.
I'm going to say this: change your toothbrush.
Oh, okay. Yeah,
There
change
you
your
go.
toothbrush.
Yeah, so I don't have any data to suggest why a toothbrush is necessarily different than a stuffy, other than that's really going in your mouth and it's happening ideally
What about your
twice a day.
toothpaste?
Toothpaste is probably fine.
It's
probably
touching it
clear.
though. It's touching it.
You know what? Throw it all.
everything away.
Burn it all.
Burn it all.
There you
Okay,
go.
burn it all.
Be safe.
Another question. One time when I was younger, my dad had strep in his elbow and had to go to the hospital. Is that because a kid licked his elbow?
I have no idea. I hope a kid was not licking his elbow. But strep is a bacteria. There's different types of strep. So we're in strep throat, we're considering group A strep. There's also strep pneumonia, strep epidermidis. There's different strains of strep. So who knows what kind of strep was in this patient's elbow. Hopefully it got better and hopefully nobody kissed it.
Well, when I was giving birth, they said I had strep.
Yes.
But it was strep.
Yes, and that is group B strep. So again, different type of strep causes different issues. And I'm an ear, nose, and throat doctor, so group A strep.
You don't need to remove these tonsils.
Is in my zone, so those tonsils are somebody else's problem.
Somebody else's problem, indeed. Can you speak a little about the recovery from a tonsillectomy?
Yes.
Yes, please.
I speak about this every day. So I basically, children and adults, I say is a little different. If I'm sitting across from an adult, I say this is going to be the worst sore throat you have ever had, and it's going to last for probably 2 weeks. And I don't say it to scare them, but I say it because that's honestly what patients tell me. It's miserable. They don't eat, they don't drink. Sometimes they lose weight.
Ice pops.
Ice pops help. And I tell people whatever they want to eat and drink is okay, as long as they're staying well hydrated. That's the most important thing. You can go for a few days without eating a lot, but you got to stay well hydrated. And staying well hydrated reduces the risk of bleeding. And bleeding is what keeps me up at night as a surgeon after these surgeries. And bleeding, the risk of bleeding can happen up to 2 weeks after surgery, which is crazy. But so the way that it works is there's basically 2 risks of bleeding. The first one is called primary bleeding, and that happens the first 24 hours. That's pretty uncommon. That happens in probably about 1% or less of tonsillectomies. Secondary bleeding happens usually a week to 10 days later, and that's when the scab in the throat falls off. And that's often when people say the throat pain is the worst, is a week or so afterwards when that clot starts to separate. But recovery is not easy. It's easier in kids because they're more resilient. But I try to counsel parents and patients, adult patients, about this all the time, especially adults who come in and they basically ask for their tonsils to be removed because of bad breath or some other issues, or a couple strep throat infections. I really try to have those adult patients force me to take their tonsils out, and I will oblige. There are certainly circumstances, but a kid with sleep apnea, severe sleep apnea, moderate sleep apnea, big tonsils, those got to go.
Okay. When my daughter was really little,
so cute, your daughter, when she was really, and right now.
She's always cute.
Fact.
Just gets cuter and cuter.
Yes.
But when she was really tiny, we had to take her back to the hospital. She had jaundice. And it was really scary for me to be in the room and everything like that. And being a first-time mom and not knowing what to expect was really freaky. So I want to kind of ask you the hard question, and this might be hard for people, but if you can explain to me the process a little bit, or even as a parent, I mean, we're allowed in the room when this is happening. What's happening?
Oh, you mean during surgery?
Yeah, during a surgery. Yeah.
So for a kid to get their tonsils out,
and they're put under.
Yeah, they're all the way asleep.
All the
way asleep.
Okay.
With a breathing tube and everything. So usually a parent will walk the kid into my operating room.
Okay.
And there's good evidence to support that actually having a parent next to the child as they become induced or basically put to sleep can help with how they wake up, and they're less agitated. And can help their recovery. But once the kid basically gets put to sleep, parent leaves the room, we usually turn on some music depending on the mood of the OR.
Thunderstruck, AC/DC.
Always on repeat. But essentially what we do is we have to open the kid's mouth so that you can visualize the tonsils, and you grab a hold of them. And, there's several different methods for cutting them out, whether you're shaving them down or you're using electrocautery to essentially burn them out. It usually takes about 20 to 30 minutes. And then we use a little angled mirror that maybe you've seen before, like a dentist's office or something,
Yeah.
to look through the mouth and up in the back of the nose where the adenoids live. And we remove those as well. And so, while, tonsils, we worry about pain in the area, we're also working inside, in and out of a kid's mouth. So there's, sometimes kids have a swollen lip, or if they have a loose tooth, it comes out. So it's also important to tell parents about that as well. But, the kid's asleep the whole time, and certainly make sure that all the bleeding is well controlled before the kid wakes up, and hopefully wakes up smoothly. And then they wake up oftentimes crying, and then it's a rough 2 weeks. But, I tell them that recovery can be challenging, to treat the pain, make sure they're well hydrated, make sure someone's keeping an eye on them.
They get all the ice cream they want, right?
All the ice cream. And that's what I tell
That's
the
what
kids.
here's like the rules.
When kids are scared, I basically tell them, you're going to be able to eat whatever you want. You want ice cream? Mom, dad, get them ice cream. Whatever ice cream they want.
Okay. We have I think a couple minutes left.
Sure.
One other question I have, and this might sound like a stupid question.
There's so many questions.
Oh yeah, we have a bunch of questions. Well, does it impact your do you remember that episode of Hey Arnold where one of those kids got his tonsils removed and then his voice was a lot lower? Will it impact your
So I need to watch that. But no, I do not have a memory of that Hey Arnold episode.
Okay.
But yes, removing your tonsils can affect your voice, especially in
Adults and kids?
Especially in adults.
Wow.
Where they have really big ones, because the tonsils are part of your airway and your upper airway. And this is also your resonating vocal tract. This is how you articulate. So if you have big tonsils, that's why when people have real bad tonsil infections, it's called the hot potato voice. They sound like they have my food in their mouth, because it affects the way they speak. That was not really a good impression, but
I thought it was good.
So when I'm considering operating on adults, I do ask them what they do for work. I ask them if they work as a singer or they are a professional singer, because knowing that would be important to counsel them before surgery, that this could change how your voice sounds. Not necessarily it will, but it could.
That's huge. Okay, we have a bunch of questions. Okay. Let me read. We'll get game 524. So son had TNA in November, 4+ and 75% for recurrent strep and SDB. Saw improvement in sleep. Now hear him with heavy nasal breathing. I assumed it was allergies, but meds not helping. Should I go back to ENT?
Great question. So let's break that down. So son had a TNA, tonsils and adenoids removed, in November, so about 9 months ago, then 4+ and 75%. So that refers to the tonsil size and the adenoid percentage of obstruction. So 4+ for tonsils is basically as big as they get. They're probably blocking the whole throat. They may even be what we call kissing, touching each other in the throat. And 75% blockage in the back of the nose is significant. And it seems like the indications were recurrent strep throat and sleep disordered breathing, or sleep apnea. So this poor kid seemed like was having a tough time and had a lot of issues in the throat. There was improvement for sleep, and then now we're still having heavy nasal breathing. I assumed it was allergies. Meds are not helping. So should you go back to the ENT? I think you probably should. There could be other causes of what you're calling nasal breathing or blockage. Allergies can cause swelling in the nose, especially these tissues called turbinates can become very swollen and can block and can also cause snoring. But this also leads to a really important point that tonsillectomy and adenoidectomy is the first line treatment for sleep apnea, but it is not 100% cure. I want to say the improvement rates are as high as 60 to 70%, but that still leaves a significant amount of children who have issues after surgery. And typically there is an algorithm after this. And the first thing to do is to evaluate the child. And you may want to get another sleep study. If there wasn't one, then they should get the first one. Could this be a different type of sleep apnea? And then if there is still sleep apnea, what we typically do is evaluate the airway while a kid is sleeping. So in the operating room, we put the kid to sleep, like a light dream sleep, twilight, and we look in their throat with a little camera and we see what's causing the snoring, what's blocking. Is it the tongue? Is it something in the voice box? Because tonsils and adenoids are the most common cause, but they're certainly not the only cause of obstruction. So to answer the question, I would certainly go back to your ENT. And, unfortunately, this is part of the journey for some patients. And, that is another thing that I do mention to families, depending on what we're trying to treat. If we take out the tonsils, they shouldn't have recurrent strep throat in the tonsils anymore. Tonsils are gone, but they can still have sleep apnea. So, that I guess I would call that a treatment failure, but that happens in a not insignificant amount of children. So I hope your kid gets better, and maybe it's just snoring when they're sick. Maybe it's allergies. There's certainly ways to treat that, but thanks for bringing that up. That's a really good question.
Good luck. Get game 524.
Mm-hmm.
I think we're pretty much at time.
Wrap it up?
Yeah. So
Okay.
if there is like one thing that you want everyone to walk away with after watching this, like what would that one thing be?
That's really tough. I probably should have rehearsed this answer. I have so many conversations on the daily about tonsils, about strep throat, about snoring and sleep apnea. I guess the one most important thing that I would take home is that snoring in children should be evaluated. It should. If your child is snoring every night, that could be a sign of something more alarming. And a lot of patients don't realize it. And when I see kids in my clinic, even if they come in for ear infections, or something a little unrelated and allergies, I will always ask if they're snoring. And I do catch kids like that because a lot of parents aren't aware. They think snoring is just normal. And I ask, is your child snore? Oh, yeah, every night. Well, do they ever stop breathing or struggle to breathe? No, not really. Okay, do they have any attentive issues? Do they wake up feeling poorly rested? Oh, yeah, my kid can never sit still. And, my kid can never sit still either. But, trying to understand, could there be sleep apnea, which could have a whole host of consequences? I'd say that's probably the most important thing that I want people to be aware of, that snoring, it can be normal, but it should certainly be evaluated. Yeah.
That's a nice note to end
Yeah,
on. Yeah, really helpful. Thank you, Dr. Dillon.
Absolutely. So these were some great questions.
Yeah.
I appreciate everyone who joined. If I didn't get a chance to answer your question, I will review all of these. I may make a separate video about the kissing teddy bears and the kissing elbows. But I want to thank you all. Laura, you're the best. Thank you so much. This was a lot of fun, hopefully informative to people.
Is this recorded?
This is recorded. It's going to go on YouTube. It's going to go on the podcast. So final sign off. I'm Dr. Dylan Levy, ENT surgeon, BoogerDownBronx, cutting through the nonsense. Thank you very much.